Well, welcome to Parent MD. We have a special guest with us today, Dr. Greg Canty, coming to us from Kansas City. So welcome, Greg.
Thank you very much for having me, Josh. It's a pleasure to be here. It's fun working with Parent MD. I've had a great time today.
Well, good. It's been a great day, and we'll, of course, go through the discussions we usually do to learn a little bit about you so the parents can know more about who you are, where you practice, and talk a little bit about the toolkits. But, just to stay up front, today was a blast for me. Obviously, it was great reconnecting with old friends. For those of you all that don't know yet, Dr. Canty and I, we come from similar small little places in Kentucky. I grew up in a small place called Richardsville. He grew up in a place called Beaver Dam, which was not far down the road from my grandparents, and I went to every summer. And the treat from my uncle would be to take us over to Pizza Hut in Beaver Dam, which is right near where Greg lived. But we went to college together, Western Kentucky, medical school at U of L, trained in pediatric residency also together at U of L, and it's been fun watching each of our career paths over the 25 plus years and seeing them meander, and then coming back here today as we enjoyed conversation late in the night last night, catch up on where we're at and old friends and stuff. So really appreciate you being here today. Good personal treat for me. And I think it's a great treat to bring your expertise, your wealth of experience to the parents at Parent MD, and just appreciate you being a part of it.
I appreciate you asking me. I feel a little older now after you just went through that description of how long it's been since we've been through all that school and training and life. But it's been fun to watch your career, and I'm excited to hear where Parent MD goes, and I'm happy I could just contribute a little bit to your mission.
Yeah, well, I appreciate that. And, you typify the clinical experts that we want to bring to the table, those who are truly, first and foremost, an expert in their field, those who have a passion for children and parents, those who can be articulate, energetic, and advocates for children and want to further our mission, to empower parents and for us to be that trusted partner for parents. And so appreciate you being here. And we're early in this journey, and we're really excited that where we're going to be this year as the company launches. And I'm really excited to share with the group today as we move into this conversation how excited I was today of the toolkits that we shot. So we'll talk a little bit as Greg gives his background, but Greg brought to us toolkits in the area of raising the young athlete, which was I love the conversation. It took me back to my two boys who are older now and all the sports they went through and all the nuggets that you gave that will really help parents and I think help kids and help coaches and such. But then talking about all the common conditions and injuries that patients, often have in their teenage and early athlete years. So I am so looking forward to getting that out to the public and to our members. So with that being said, so folks can understand the perspective and where I'm coming from and why I think what you brought is so valuable, why don't you tell the audience, our members, a bit about your background in life and your education and then your career journey and where you're at now, and we'll go from there.
Great. Sounds fun. Well, you told a little bit about both of our paths kind of growing up in Kentucky and our pathways through medical school. Probably the one thing that makes a little bit of things unique is I grew up, basically my dad was a basketball coach when I was younger. So sports medicine came to me early. I didn't even realize it. And so I've been able to meld a couple things in my career. But I grew up in Kentucky where basketball was king, and I grew up hanging out in the gym, playing basketball, watching my dad coach, and just thinking that was the be-all, end-all for the first 8 to 10 years of my life. And that was fun. And so another little thing of how many careers in my life came together is I grew up loving basketball, but I also had both, I think, almost a blessing in that I was diagnosed with a chronic childhood condition, and I had juvenile arthritis at a young age. And so sometimes my dreams of basketball got intermingled with my interaction with the healthcare system. And I can remember going to play sports with a big swollen knee. And I remember many times when you talk about my youth, you've asked me about this a couple of times, is my grandparents weren't so sure that my parents were making the right decision by letting me continue to play. My parents saw the pleasure and the glory in use for sports. And I don't say glory in a way like sports glory, but just the joy that I got out of playing. And they continued to encourage that and allowed me to continue to play. And so I tried to always think about that as I've gone about my career of how do I bring the pleasures and joy of sports participation to everyone, not just those patients who are going to be elite level athletes. Those are few and far between. We joke a little about, the average numbers say that less than 1 to 2% of all high school age athletes are even going to go on to play in the collegiate level. But how do I make sports just a part of your healthcare journey? How do I make it part of living a wonderful life, both your mental and physical health? I was able to benefit from that. And so get a little lost in the weeds there talking about that, but it was fun, a little bit emotional to hear about the impact that they had. Then I went on to medical school and naturally was drawn to the field of pediatrics, having grown up being cared for in a children's hospital. And so I naturally gravitated towards that and never heard of sports medicine. Back when you and I were training, it wasn't a subspecialty that existed. It was pretty much unheard of. I went out in the workforce and initially was drawn to pediatric emergency medicine and still enjoy a lot of pediatric emergency medicine background and training, which I practiced for a while and did a fellowship in pediatric emergency medicine. I found myself continually drawn to the musculoskeletal injuries, musculoskeletal conditions, worked a little bit with kids that had juvenile arthritis, and lo and behold, this growing field of pediatric sports medicine came into onto my radar. I made a decision about 13, 14 years ago that I was going to go back and do an additional fellowship training in sports medicine. And so I did that. And then I ended up in Kansas City, Children's Mercy Kansas City, a wonderful institution there in the Midwest. And I've been practicing. I've been the medical director of the sports medicine center there starting back in 2010. It's been a wonderful experience. I think that we've grown a wonderful program there. As myself, I have, at the current time, I've had up to 3 other pediatricians that work alongside us. I have 2 orthopedic surgery partners, and then we have about 27 athletic trainers, and I believe around 15 physical therapists, with our sole mission, which was helped me draw in part of my career. My mission has really been, how do I take youth sports participation and advocate for healthy lifestyles, really with a focus on that adolescent age athlete, because I feel like that's really that's really kind of a population that was underserved. They don't typically require surgery. They require a proper diagnosis, proper treatment plans, and rehabilitation, and a large just the ability to be able to communicate with an adolescent patient and their family. Oftentimes we joke about, oftentimes when you take care of medicine, you're taking care of it. It's a patient and provider relationship. When you take care of an adolescent athlete, it's way more complex than that. You got the patient, you got the provider, you got the family. Hopefully they're all on the same page. And many times they're getting pressure from the coach, and it's been fun. But I tell everybody, you can probably look back in your days of general pediatrics, nobody ever comes in and says, "Hey doc, can you help me feel better? I got a breathing contest in 5 days and I want to be ready for it." All my patients come in, they all like, "I want to be ready in 4 or 5 days." They're like, "Oh, let's take a step back here. Let's figure out what you got, and let's help you get better, and let's help you continue to stay active for life." Yeah. It's been fun. It's been a fun journey.
No, and obviously, and when we talked, and as I've seen through your career, we talked about the book titled Range by Epstein earlier, and talked about how the different changes in the career, and we both had a number of changes, and we kind of went where our heart and passion was, and where we thought our interests and skill sets. You're too humble. You went to WashU for your Peds ED fellowship, correct?
Actually, I worked in WashU in the pediatric emergency department there. I actually did my fellowship at Children's Mercy in Kansas City. That was my first introduction there.
That's where you did your fellowship. Okay. Mm-hmm. And then you went to Denver, though, for your sports medicine training, right?
Correct. I did I did sports medicine training at the University of Colorado, where we worked at Colorado Children's Hospital, along with the University of Colorado and the University of Denver. So I had the pleasure and opportunity over my career to take care of various levels of athletes, everything from the recreational young adolescent athlete, families just figuring out, what do we do? What's this whole sports world about? To a large number of adolescent athletes, to take care of professional athletes, collegiate athletes, and what we call kind of academy level athletes, folks that are really looking to go to either college or the professional level, minor league. So basically, I've got to see the wide breadth of sports-related injuries, conditions, situations that come along with that, and it's really been fun. It's been a great career that I've enjoyed.
Yeah, your perspective is another reason I was so excited to have you come and spend a day with you. Your perspective as a general pediatrician, as a peds ER doctor, as a sports medicine doctor, which, is now that's kind of become your groove, obviously. Mm-hmm. Perspective as a father of 3 girls, yes. As you just shared your story earlier, because I was going to ask you about that later, is, you're growing up with juvenile arthritis, and then you talked about how you saw the world and where you found joy in sports despite the pain. I won't forget in college and med school at times seeing you on crutches. Mm-hmm. I mean, you're just ambulating around, but you always had such a positive demeanor. It didn't matter. Those crutches were there. You didn't act any different. And that persona that that positive outlook, I know that's portrayed and shared with your patients and families today, because I've seen it shine through the years. And then obviously growing up in a very coach athletic based family, I think just totally packages you to provide so much value to the families today. So with that being said, I want our members to know how exciting and fun it was to listen to you talk through all these nuggets and bits of wisdom today. And I look forward to sharing, and we'll talk a little bit about those in the show today. With all of that being said, your education, your career, your training, I think we got a good bit of background there, why you went in there you did, and why you, that is your zone, so to speak. When it comes to parents coming to see you, and we talked today about a lot of the reasons parents do come see you, what would you say is the number one thing that people are wanting when they come see you? Are they wanting resolution? Are they wanting to know when resolution will come? Are they wanting support for you to help them move an initiative so their child can be back into sports quicker? What's the biggest thing that you see parents wanting to achieve when they come see a sports medicine doctor?
Great question. As I think about it, I think the first thing that they want to know is, what is it? What is this? Because oftentimes they've had symptoms, they've had concerns, maybe they've been to other specialists, and they're still not confident what this is, and they haven't spoken with someone who speaks that language. We know we bridge an interesting gap between the people that hang out all the time, that are sports and coaches, and then doctors. And we try to bring those two worlds together of how do you combine healthcare and their athletic pursuits. They're all excited when I can just even speak their lingo. And then once we can help them figure out what it is, and they will obviously always, many times they're wanting to know, well, now that I know what it is, what do I do to get better? Right. And when can I go back to play? Or can I go back to play? And there's a lot of fear too, because as we talk about in some of the toolkits, people watch TV, and I tell them there's ESPN medicine, okay, and then there's youth sports medicine, and they've seen something on TV and they think that's what's going to apply to them. And sometimes it does, but more often than not, it doesn't. And so you really have to spend some time and effort having those conversations, educating them about the growing skeleton, educating them about common sports conditions and how to approach it in a youth athlete. And then oftentimes, we're in the process of that, I'm able to drop a few nuggets on them a little bit about things that maybe they didn't come in asking about, things we touch upon in one of the toolkits about raising a young athlete, talking to them about how to pick out, how to choose sports, what to think about, what's an overall mentality they should take into sports, promoting joy in sport, and then helping them think about how can they kind of improve their athletic performance. And it's usually not the way they think. We're talking a lot of things about like sleep and nutrition and mental health approaches to sport. So it's kind of fun. There's kind of things that they come in, and I try to answer those questions, and I try to give them a few nuggets when they leave, thinking, I hadn't thought of that, but I leave more prepared to take better care of myself.
When you talk about the conversations with the parents, what I was most intrigued today was the conversation around encouraging the parents to be the role model, personal, emotional well-being coach in this realm of athletics. And it's different for they're younger, and it changes as they get older, and making sure that child understands the expectations and initially about that child having fun and being exposed to things in a safe manner. Those children getting support and encouragement, inspiration from you, but not being another coach who comes home and rails on what they didn't do well, and helping foster and not break that spirit. And I know all of us as parents, when you want to see your kids achieve the most, sometimes it's hard to strike that balance of where do I push them to be their best versus backing off and leaving it be. The other thing that I was thinking about at the end of our conversation today, we really focused on parents and their role with the child. And we talked about a lot of what parents working with coaches need to do together as a team. But it also made me reflect on those coaches that I felt like for my two boys who are 24 and 21 now, who really had such a positive impact on them.
Yeah, correct.
And then there were a couple that had, I would say, a negative impact on them. And, that's not all bad because there's a lot of lessons learned in that.
There are.
We all had a coach or two that was negative. Our parents would prefer it not be that way. But when you reflect, you look back and like, well, some of the best lessons learned in life were my negative experiences.
Right.
Which that goes to another conversation we had today when we were eating some lunch and eating some chicken tacos from Torchy's and just reflecting on enjoying all that we have been talking about. But at the end of the day, some of the hardest things that happens in a kid, it's okay. And parents, long story short, it's not our job to shelter our children from everything. So we need to help and resource and love, encourage, and inspire, I always say is our job. But at the end of the day, kids have to go through some rough things on their own. They have to sometimes go have that difficult conversation with the coach by themselves. I remember my boys a couple of times that, they share with me someone they share, and their mother and I both said, well, you need to kind of go have that conversation with the coach. And that, I would love to be there with you, but I know that's not best for you and it's best not for me. And you need to have that. And, they manned up and had those conversations. And when you support your kids in that way, some of those difficult times are the most influential in their personalities and development.
Yeah,
so.
I think you're there hopefully to try to support your kids. I think that's the big thing, to try to reframe a little bit about that, how the athletic journey goes for many people. And we talk a little bit about that, setting out what are you and your family's goals for sports participation? What are you expecting out of this journey that you go into? Along with that, I think it's important to kind of talk about some of those things and lay those things out, and also reminding parents that this is not about you. And it's hard because I think parents mean well, they really mean well. And maybe their either their success or lack of success as an athlete feeds into their desire for their own kids, either to achieve their goals but they have good intentions, and you try to take people and take those good intentions and give them some tools to help them say, here's how you can support your young athlete. The analogy you use, I never really support bad coaching, and to a certain degree, I can say we all learn different things from different coaches, and I hope they all have good intentions. But I tell them, we made an analogy today talking a little about bowling. I was like, this is kind of like you're the kids, you want to keep them out of the gutters, okay? But you got to get them out there in the playing field and see if they can get that bowling ball down to the pins and help them learn how to, those life lessons that come from sport, teaching them to get out there and provide leadership, provide teamwork, have those interactions with adults, take some of their own accountability and responsibility. Those things there are very few places in life. It's amazing the things that you learn through sports participation. And we talk about the benefits. It's been shown over and over for like CEOs, adult leaders, particularly as the father of 3 females, young athletes. The benefits to since the advent of Title IX in 1972, it's like young girls have got a lot more opportunity for sport, and we see that these business leaders and CEO leaders, many of these ladies have related a lot of what they've learned in life and how to navigate the world and people and their determination and their drive from sports participation. So I think there's a lot of good things that come from it. And so I'm a little biased towards that crowd too, because I have 3 young girls. And as I jokingly say, if my siblings are sitting here in front of me, I'm one of 4. The best athlete in our family was our sister. She was a Division I swimmer. And so, so I was like, so I'm a big advocate for that. And, but I think sports, when done correctly, is a gift to everyone's life. Both you can use it as it can be a great family bonding tool. It can be a great avenue for promoting physical activity and overall general health. It doesn't matter if you have a chronic disease like I had, or if you're an elite level athlete. We know the benefits of that participation. I'm big on sports participation for all, from the highest levels to recreational levels. I think there is tremendous value to our society from that. And so I'm a big proponent for that at all levels. And I hope that your listeners take that away, take that message away from our discussion today, and they kind of look for ways, even in their community, just to promote the many benefits that can come from sports participation.
Yeah, and we had a good balanced conversation. You did this morning, talking about those who worry about the risk of injury and such, and everything's about risk and benefit, risk and reward, and the benefits and rewards, I feel like you articulate so well, are so many and so abounding, for kids to play. Again, when I reflect on my 2 boys, which is where I've learned a lot, they both love still to play basketball. And I see that they love doing it. One, they just really enjoy the sport. So they gained a lifelong appreciation for a sport that they can go out and engage with others. And so they love playing the game. They love, I think, being more physically conscious, engaged in working out, so they can play, and so they're more health minded in what they eat, how they exercise, and everything because of that. For them, a lot of their best long life friends came from those sporting activities with teams where they bonded, and to this day, at this age, a lot of their best friends come from those arenas. So there's so much richness. And then the other thing I would say is confidence. Yeah. They have confidence in themselves. And what was really neat to me, watching two siblings love playing that together. You know, some of our best memories have been when, you know, you shot basketball on the outside the driveway with your kids, and or for us, golfing on vacations and such, because we did it together. You're spending time out there and you're enjoying a sport. So there's so many other benefits. So I love that you highlight that. I really liked a lot of the conversation today, not in just, we talked at the end a lot about a lot of the common conditions and common injuries, but again, that raising the child athlete and the influence the parent can have, the responsibility and the power, and how you don't want to misstep, and it can be a fragile area, and to guard it and really learn from others. Sadly, I think a lot of us learn those lessons after we do some things wrong, and you get there like looking back like, I should have done that different. Yeah. Well, this is where I want folks to be a part of Parent MD. Learn from the experts, learn from other parents, other pediatricians, and take some of those things that were learned. And we talked today how nice it is for you to have, you know, hours of video today created so parents and people and coaches can just watch and listen to all of it. When I asked you, you know, can you ever have this much time to give to any one patient? You can't. So when you got a 15, 30-minute visit, you can't spend 2, 3, 4 hours telling them everything you think. And I thought it was funny today, a couple of times you asked that, am I telling too much? Is this? I'm like, no, it's everything parents need to know, but there's no way they can get this much time with you. So enjoy it. Let's package it. Let's share. You know, there's so much to share, and there's just not enough time. And I think there's so much wisdom, experience to be had from folks like you and other parents. I was a little tangent from a conversation we had earlier today, but I think it's key to share, and a good shout out to a mentor of ours. You know, we're talking about the mentorship and the impact of those who influence your life, who said words of encouragement or just helped you, and they coached you in different ways, maybe not in the sports arena. But you and I both had a very common path in going into pediatrics. So one who is a person you still work with today at Kansas City, and just a shout out to Dr. Denise Bratcher. Yes. So she is over, tell me her title so I make sure I know it's with the graduate medical education. She's director of graduate medical education at a vice presidential level there at Children's Mercy in Kansas City, and was a part of her positive reflection and everything else from our time together in Louisville when she was at the University of Louisville, and then her subsequent career path out to Children's Mercy in Kansas City was a big reason that you followed out that way. I followed out there in the first place. I was and so yeah, she was very influential on both of our medical careers, and she was a coach. She was a coach to us. So well, that's she coached us both into pediatrics. Somewhat, that's what I was getting at. Ironically, and that's why I wanted to highlight her while we're together in this unique situation. She was the whole reason I decided to go into pediatrics, because my experience when she was my attending third year medical school, and she was a big influence for you, your fourth year medical school. Correct. And so, and today we're both pediatricians and having this conversation, and right here. You know, I think it's neat how the world works. With that being said, as we're getting near wrapping up, I want to ask you a couple questions. What advice would you give pediatricians in talking to parents about you know, these young athletes? And then after that, what's your number one best piece of advice you think for parents as we wrap up? Oh, wow. Two pretty good asks right there. And so I hope I can give answers worthy to that. Yeah. And so I think that let's start with what pediatricians can do. And I really think that's why I was so passionate to hear about your project and kind of engage with this project, because I really think a big thing for pediatricians is I want them to stay engaged in the adolescent athlete life, understand the pressures and risk and things we talk about every day. As I mentioned earlier, you kind of touched a little upon, we know that adolescents that have remained active in sport, and it can be any sport, it doesn't have to be the traditional team sports. I think that's one thing we maybe get wrong in our society is
let the adolescents tell us where they want to go. Let's keep them active and doing stuff. Let's allow them to pivot, try other sports. Maybe they get burnt out, maybe do this, but allow them to pivot. But I think the person who help guide them through that life that can be a healthcare resource for them is I love the pediatrician remain involved. Pediatricians are specialty training. They're experts in taking care of adolescents. That's a large part of our training. No one else that they see in the sports medicine world does that. And so I really think having that perspective is so important. And I think maybe pediatricians, the more they can learn about sports medicine topics, whether that's through professional education, whether it's part of their primary training, whether it's coaching their own kids' sports, whether it's involved in that sphere, I want them to be seen as a resource for those adolescents going through those transition phases, because I believe that they have young kids' best interests at heart. And so I think that that's how I would say, that's what I would say to pediatricians. We have, and where I currently work, I have the luxury of getting to work with residents, which are people training in pediatrics and we train sports medicine fellows who are trying to gain expertise and doing additional years of subspecialty training. And that's really what I try to, that's the message I try to give to them, and that these conditions are out there everywhere. These folks need support. They're looking for reliable resources. They're looking for information. Please help that be you. And I think that's what you're doing here with Parent MD, is really trying to help bridge those gaps. And so I give a huge shout out to you for recognizing that need and helping bridge those gaps. I think if you had to ask what's my best advice, I believe you asked for parents that are in my best advice for parents that are raising young athletes is, again, I think I may have spoke a little bit in the earlier notes. It's not about you anymore, and it's about how to be supportive throughout your, we want to use sports as an avenue for personal and professional growth. And you can make this a good experience. With a little bit of barriers, a little bit of understanding, you can make this a wonderful journey that you can promote health, both physical and mental, for your kids. You can give them tools to make them grow into leaders and adults. And you can have a great experience together as a family that you can then carry on and bond for years. We've talked about the fun times we've shared going to, sporting events with family and friends, and a kind of and those are just experiences that, let's use sport as a way to enrich our life and find joy in our life, rather than maybe full of pressure and coercion and figure out like things that people, that they're disappointing because they don't achieve this and they don't achieve that. It's like, let's focus on all the good things it can bring to life. If you put up the right plan, which I hope that some of the things we talked about today give people like, oh, here's some framework. Here's things for me to keep in mind as how a young athlete goes through various stages. Here's what to think about when they're young. Here's what to think about when they become into adolescence. Here's what happens when they're in the mid to teenage years. How can I help support them at each phase of life? And again, be there to enjoy their path and enjoy their journey and watch them grow. And I think if you keep that mindset throughout your sporting endeavors, you're going to end up in a good place. And it's going to be a great experience for both you and your kids.
Yeah, well said. Appreciate the conversation today. Appreciate you coming back to Louisville, Kentucky, and the time and helping us give this information transfer to parents. So appreciate it. We'll look for you to come back and join us again someday.
I've had a great time, Josh. Thanks so much for asking me.
Thank you, Greg.